Hello, my name is Roham Hamidi, and I'd like to talk to you about atherosclerosis, a disease that's responsible for over 500,000 deaths every year. I'll begin by giving you a general overview of what atherosclerosis is. After, I will go into details about what specifically is involved in the onset and progression of atherosclerosis, followed by the drugs that are currently being used as treatments, and finally end with potential new treatments that are currently under research. So let's begin with the general overview. First off, atherosclerosis is a type of arteriosclerosis, which is a term that refers to the thickening and hardening of the walls of arteries. Artery walls are usually very durable and elastic, which they need to be since they experience high amounts of pressure from blood flow. However, when they thicken, they lose the strength and elasticity they need to be able to withstand these pressures. Atherosclerosis is a specific case of arteriosclerosis, where different cells and compounds aggregate in a single spot in an artery, leading to the formation of a fatty plaque. The plaque eventually ruptures, which causes a blood clot or thrombus to form. The thrombus can travel through the bloodstream and deposit itself in any vessel, and the symptoms that arise can vary depending on where the thrombus ends up. For example, if the thrombus deposits in an artery that feeds the brain, it can lead to a stroke. If it deposits in an artery that feeds the heart, it can lead to a heart attack. Now that I have given you the general idea of what atherosclerosis is, I will go into the details of what specific components and processes are involved in the onset and progression of atherosclerosis. The first molecule I will be talking about is cholesterol. Cholesterol is a steroid molecule that is made by cells in animals and is inserted into cell membranes. Their function is to help maintain the membrane's structural integrity and fluidity. Since cholesterol is a hydrophobic molecule, it can't freely travel through the bloodstream. Instead, it has to travel by being bound by lipoproteins in order to get around the body and enter cells. These lipoproteins are essentially complexes that are made up of proteins and lipids. There are two major classes of lipoproteins: high-density lipoproteins, or HDL for short, and low-density lipoproteins, or LDL. You may have heard that there are two kinds of cholesterol: good cholesterol and bad cholesterol. Well, LDL is the bad cholesterol. It's known as bad because it promotes atherosclerosis, which it does by crossing artery walls which have been damaged by extrinsic factors, such as smoking or high blood pressure, and depositing its cholesterol and fat molecules into the artery. On the flip side, HDL is the good cholesterol. It's good because it removes the bad cholesterol from the damaged arteries, thereby reversing any sort of progression of atherosclerosis. Here I would like to emphasize the main differences between LDL and HDL. In the left image, you can see that HDL is composed more of protein than of lipid, while LDL is composed more of lipid than of protein. In the right image, you can see that LDL is responsible for promoting atherosclerosis, while HDL is responsible for preventing it. Monocytes are another critical factor in atherosclerosis. Monocytes are large white blood cells that are circulating the body looking for anything, living or not, that shouldn't be in the body. When an artery wall is damaged and LDL enters it, inflammatory signals are released. These signals cause the monocytes to come to and enter the damaged site. And once they enter, they quickly differentiate into macrophages. These macrophages, which are cells that engulf foreign substances via a process known as phagocytosis, attack the LDL and uptake the cholesterol in an attempt to eliminate it. But when the macrophage ingests too much cholesterol, it swells and turns into a foam cell. When too many foam cells become present, they aggregate and contribute to the formation of the plaque. MCP1 is the molecule that acts as the inflammatory signal which attracts white blood cells, or leukocytes, to the site of inflammation. It is initially released by cells in the artery wall. However, when leukocytes arrive at the site, they begin to also secrete MCP1, which attracts even more leukocytes. The way that MCP1 brings the leukocytes to the site of inflammation is through a process known as chemotaxis, which is the movement of a substance in response to a chemical stimulus. Leukocytes are attracted to MCP1, So they want to go where the highest concentrations of MCP1 are. So since the source of MCP1 is at the site of inflammation, that is going to be where the highest concentration of MCP1 will be. Thus, it will also be where the leukocytes will ultimately head towards. The way that the leukocytes are able to actually travel through the body to the site of inflammation is through a process called leukocyte adhesion. On the surface of blood vessels, there are adhesion proteins which the leukocytes bind to. The leukocytes are able to move along a blood vessel by continuously attaching and detaching from these proteins, thereby making it look like the cell is rolling along the vessel. Inflammatory signals will cause selectin proteins to be expressed at the site of inflammation, and when the leukocytes arrive, the selectins will cause the leukocytes to stop and enter the vessel at that site. Endothelial cells are the cells that line the interior surface of blood vessels, and they are the cells in the artery that express selectins. They are also the cells that secrete MCP1. The subendothelial space is the area in the artery under the endothelial cells where the LDL molecules go. It is here where the macrophages engulf cholesterol, accumulate as foam cells, and form a plaque. The extracellular matrix is a collection of molecules and compounds, such as proteins and sugars, that are secreted by cells and stay in close proximity to the cell surface. It provides structural integrity, not only to the arterial wall, but to the plaque as well. So when the extracellular matrix is weakened, the plaque becomes more prone to rupture. Collagen is the main structural protein of connective tissue in animals, and also plays a role in strengthening blood vessel walls. When the plaque ruptures, excessive collagen, which may be secreted by smooth muscle cells in response to LDL, is exposed, leading to the hardening of the artery wall as well as to the activation of platelets. Platelets are blood cells that form blood clots when there is bleeding. Normally this is beneficial to us, but in the case of atherosclerosis, it's responsible for the formation of the thrombus. When the platelets are activated, they begin to aggregate and ultimately form a thrombus that can get dislodged and deposit itself anywhere in the bloodstream. The activated platelets also release inflammatory signals that cause more monocytes to come to the site of inflammation. Phospholipids are compounds composed of a diglyceride, a phosphate group, and an organic molecule, and are the major component of cell membranes. They are also a major component of HDL and LDL. These phospholipids are important due to their involvement in lipid oxidation. Oxidation is a process in which an atom or molecule loses an electron. In lipid oxidation, a radical, which is an atom or molecule that has an unpaired electron, steals an electron from the phospholipid of an LDL. The presence of oxidized LDL is what causes the endothelial cells in the artery to start producing MCP1 and attracting monocytes. It's also what causes the monocytes to differentiate into macrophages. Lipid oxidation is limited by antioxidants, which are molecules that neutralize radicals by either breaking them down or by giving them an extra electron. The role that antioxidants play in fighting atherosclerosis is one of the reasons why they are so important to have in the body. Lysophosphatidylcholine, or LPA for short, is a phospholipid that is a major component of oxidized LDL. It is responsible for upregulating adhesion molecules on endothelial cells, thus making it easier for monocytes to come to the site of inflammation. Triglycerides are molecules that are composed of one glycerol molecule and 3 fatty acid tails. They help transport fat and glucose to and from the liver. High levels of triglycerides do not directly contribute to atherosclerosis, but they can be an indication for an increased risk of developing atherosclerosis due to their association with pro-atherosclerotic molecules. ApoA1 is a major component of HDL that promotes the removal of fat and cholesterol from tissues. It also helps remove the fats that have been taken up by macrophages from the macrophages, thereby preventing them from turning into foam cells. ApoJ, also known as clusterin, is a glycoprotein, which is a protein bound to a sugar, which also contributes to the removal of cholesterol from plaques. Additionally, it has been shown that when LDL is added along with ApoJ to human arterial wall cells, the LDL cholesterol can't induce the chemotaxis of monocytes towards the cells, also known as monocyte chemotactic activity, or MCA. Before we get into the treatments for atherosclerosis, I want to mention LDL receptor null mice, which is a strain of mouse that is frequently used in experiments regarding atherosclerosis. Normally, in mice, as well as in humans, the rate of cholesterol synthesis is regulated by the body, and that if too much LDL has been taken up into cells by the LDL receptor, then the enzyme HMG-CoA reductase, which is the rate-limiting enzyme in the production of cholesterol, is suppressed. Therefore, if there is too much cholesterol already present, then cells will stop producing it. However, since LDL receptor null mice lack the LDL receptor, they cannot detect when there is too much cholesterol present, and thus continue to make cholesterol, even when cholesterol levels are already too high. Here are some images of data that demonstrate the effects of mice lacking the LDL receptor. On the left, you can see that there is a higher concentration of cholesterol in mice lacking the LDL receptor, which are denoted as minus/minus, than in mice which have the receptor, denoted as plus/plus. On the right, you can see that there is an increased degree of arterial thickening in mice that don't have the LDL receptor, which are denoted as LDRKO or LDL receptor knockout. Now I would like to talk about what drugs are currently being used to combat against the signs and symptoms caused by atherosclerosis. First up is statins, which is a general name for a class of drugs that inhibit HMG-CoA reductase, thereby reducing the amount of cholesterol produced by cells. Essentially, it mimics the process where a natural functional cell would stop cholesterol synthesis if it detected that cholesterol levels were too high. One of the most well-known examples of a statin is Lipitor, also known as atorvastatin. The reason why it's well known is due to the fact that it has been shown to cause a more dramatic reduction in LDL cholesterol than other statin drugs do. Another example of a statin is Zocor, or simvastatin. This statin is typically used in conjunction with healthy habits such as diet and exercise to control elevated cholesterol levels. Zetia, or ezetimibe, is a drug that lowers blood cholesterol levels by blocking our digestive tract from absorbing cholesterol from the foods we eat. It does this by blocking the protein MPC1L1, which is a protein in our gut that is primarily responsible for cholesterol absorption. Vytorin is the combination of simvastatin and ezetimibe, which is used in conjunction with diet as an effective treatment for high cholesterol levels. Niacin, also known as vitamin B3, is the precursor molecule to NAD and NADP, which are important for our body's ability to metabolize glucose. In higher doses, niacin can not only increase HDL levels, but also decrease LDL levels. However, if the dose is too high, then niacin can actually have adverse effects on the body, so it is usually only prescribed to patients who can't tolerate statins. Now I would like to conclude by talking about new potential treatments for atherosclerosis that are currently under research. First, I would like to point out that, in addition to LDL receptor null mice, another strain of mouse that is often used to test potential treatments is ApoE deficient mice. These mice lack apolipoprotein E, which is a component of very low density lipoproteins, VLDL for short, which is another type of lipoprotein, that removes cholesterol from the blood and causes it to be sent to the liver. Because the mice lack this protein, they have increased LDL levels and decreased HDL levels. Below you can see an image of the aorta of a mouse that expresses ApoE and the aorta of a mouse that doesn't express ApoE. The image highlights the differences between the two mice in that the ApoE deficient mouse has far more plaques built up than the normal mouse. The first drug that I'd like to talk about is ApoJ peptide. This is a peptide that is synthesized from amino acids found naturally in the ApoJ protein. When added to ApoE deficient mice, it renders HDL anti-inflammatory and increases the ability of the plasma to promote cholesterol efflux and decreases LDL-induced MCA in ApoE deficient mice. In the image, you can see that the addition of ApoJ peptide decreased the amount of oxidized fatty acids as well as the amount of monocytes in the mouse. D4F is a peptide synthesized from D amino acids that mimics the protein ApoA1. It has been shown to increase the amount of plasma HDL, increase the ability of HDL to prevent LDL from being oxidized, and prevent the LDL from inducing monocyte chemotactic activity. In the image, you can see that the concentration of HDL increased over time in response to the addition of D4F. Finally, L4F is similar to D4F, only it is synthesized from L amino acids as opposed to D amino acids. It has been shown to activate antioxidative enzymes in the body, thereby reducing the amount of oxidized LDL and rendering HDL more anti-inflammatory. L4F and D4F, as well as ApoJ peptide, are currently under research at the David Geffen School of Medicine at UCLA. To summarize, atherosclerosis is initially caused by LDL entering damaged blood vessels. The LDL becomes oxidized by free radicals, and the oxidized LDL attracts monocytes. The monocytes enter the vessel and become macrophages. These macrophages uptake LDL and its cholesterol, causing them to become foam cells. The foam cells aggregate and form a plaque. When the plaque ruptures, platelets are activated and become a thrombus. The thrombus can deposit anywhere in the bloodstream, leading to complications such as heart attack or stroke. Although some drugs do exist to help counteract the effects of atherosclerosis, there are new drugs, mainly ApoJ peptide and ApoA1 mimetic peptides, that are currently being researched. That concludes my presentation. Thank you for listening, and I hope you learned about a disease that has become a major issue in today's world.